All right, so a very great evening to all, sir and ma'am, and even Dr. Unnati ma'am. Thank you so much for joining today's session. I may request you, Dr. Unnati ma'am, to kindly turn on your camera. Okay. All right.
Yes.
Perfect. The rest all who aren't convenient, of course, they can keep their camera off. Just be on mute. After this particular session, if there is any query related to the diet, of course, you can put up a message on the chat box, and we will allow you to speak to Dr. Unnati ma'am, and we can go ahead for the question and answer session as well. So now I would request Dr. Unnati ma'am to kindly begin with the session without taking too much of time, as most of the patient has joined. So let's begin with the process. Yeah. Thank
Yeah.
you.
Yeah. Thank you so much. So, good evening, all. I hope everyone is doing well. Am I audible? My voice is clear?
Yes, doctor, it
Yes,
is clear.
ma'am. Good evening.
Good evening. Good evening. Good evening. So, yeah, so let's start with the session. Okay. First of all, it is going to be an interactive session. So, just jot down your points, whatever you feel like. And at the end, we will surely discuss about it. What all, doubts and everything you'll be having. So, there are certain things that I would like to put here in front of you all, that diet is something, always remember, diet is something which is not only about food. Okay, that is a very basic parameter you all should understand. When we are, when we are talking it about in the context of Ayurveda, diet is not only the food, how the food reacts, how the food works on your body, everything comes under that. Okay, so you need to be very careful about whatever you are having, in what context, with what mindset you are having. Everything depends like that. Okay, there are different tastes. Like for us, we are only known to two to three things over there in taste. Just a brief idea about what exactly food and how does it work. We only know that something is spicy, something is sour, something is salty, only this much. But what beyond that? According to Ayurveda, the food and its taste, there are six type of taste which we are still not known about it. Okay, you must be knowing about the taste, but you cannot identify, yeah, this is this, that is that, like this. Okay, so we need to understand that first, like what we are taking and how it will react inside our body. We should understand that first. Okay, the first thing is that the first taste is sweet. Sweet, meetha, कुछ भी मीठा होता है, that is sweet. Second is sour. Okay, sour as in khatta, sour taste. Third is salty, that means khara. The fourth one is pungent. Pungent, I could just put it as, it is a very sharp taste, a very sharp taste which can be unpleasant at times. Unpleasant, yeah, you cannot find that find that, yeah, it is attractive, it is good. Sometimes you can just put it as sauce, some sauces which has high amount of herbs in it, so we find it, no, it is giving me a very sharp taste, which is again not good. Okay, so that is a pungent one. Now an astringent. Now what astringent is, basically it is a combination of tastes. It is a combination of taste. At times it might taste you like bitter, at times it will give you a dry tongue, it will give you a, at times a bitter taste. For example, the best example I can give on this is a green tea. Green tea is something that gives you a mixture of taste in it. Okay, and the last one I could say is a bitter taste. Bitter is something kadwa. The very rare people in this on this globe would say, like, I would love to have a bitter taste, but to be very honest, it is something very much useful for us to have a bitter taste in the whole daily routine. Like in the whole day, one thing you should consume which has a bitter taste in it. Okay, so this is how there are six tastes according to Ayurveda. Always remember, in which taste you fall in, it completely depends, because there is a relation. We have already described it earlier to each and everyone, that your body has dosh in it. Okay, so the doshas and taste work together. So according to your body, according to your body type, according to your dosha, what exactly your body favors in. Have you ever thought about it? Like, I have a hefty body. Okay, hefty body. I have good nails. I have a charming face. My skin is glowing. So, under what criterion I fall? I fall in a kapha dosh. My body has a good amount of kapha dosh in it. Other two doshas are there, but again, kapha dosh is a dominant one. So, what taste my body will prefer? This is how it is. So, your doshas will define a taste. But now, when we talk about
Talk about.
taste, when we talk about food, we always have to think about it is not a healthy body, or it is not a normal thing that we have some or the other kind of diseases or disorders or some or the other kind of metabolic things going inside our body, so body is not coping up with the things that we should actually have. I hope you all are getting it. Why we are not having the food which our body actually needs? Because we always depend on the taste. This is tasting good, I will have that. But why? It has to work good with your body. Always remember this. I always, during my consultations, I always repeat one thing: what is good for your body? Is it good for your condition? Always remember this thing. Your body will be good, your body will be healthy, it will become healthy, but when once your condition gets treated, you have to join these two parameters together. Always remember, just set up priorities regarding your diet, regarding your food. Set up priorities. I completely understand our body is our priority. We have to be healthy, we have to have good muscle mass, weight should be there, we should have a glowing skin and all of that. But when will it happen? When your internal detox is there, toxins are not there, your inner self is happy while having food. With what mindset we eat food? Have you ever thought about it? Keep the conditions, keep your keep everything what you are suffering with, keep aside, that you are following this diet for this condition and all of that, keep it aside. Just always remember with what context you are having food. We are always in a rush doing here, we have to go over here, we have to complete our work, or we have to go to bed tomorrow, again we have to get up. With all of this rush, where you think about food? This is a very, very important and a very critical thing. You should always have a good mindset. Always have a positive thinking while you're having food. Why it is said that you have to sit down, you have to be very calm, you have to always join your hands first. Thank God that I'm getting this food. Show gratitude towards that food and then start having it.
मी बाबाकडे खूप पैसे आहेत वाटतं. मी पण आता सगळं मागायला चालू करणार आहे.
Sorry, but someone's microphone is on.
I'm very sorry, doctor. You may
No
please
problem.
continue. I have muted the patient. I'm very sorry. Yeah.
No problem. No problem. Okay, so where was I? Why we always just skip this basic criterions of having food? We should sit down. We should keep our mind calm. Everything will keep on going. Yeah, work will come, work will go. Sleep will come. We have to again get up in the morning. We have to continue everything. Then why with not food? Why we are not following all the things with the food, that we have to sit down calmly, we have to just focus on what we are having. Always show gratitude towards thing. करेला कड़वा है इसीलिए वो अच्छा नहीं लगेगा, माइंडसेट है. करेला is very good, bitter gourd is very, very, very good in taste. The way you're cooking it, the way you're consuming it, even if anything is sour or anything is bitter, you should always remember one thing, that how my body is going to accept it, how it will work on my body. Of course it has something good, that is why it is a thing that we made a, like it is a thing that can be consumed. Something would be good in it. Always keep that mindset. Whenever we are provided a diet, whenever we get something, we always have that mindset, oh no, my burger is not there in the diet, I have to follow this. No cheeseburger, nothing. Okay, no cheeseburger, no pizzas, no maida products, no, nothing processed food is there. No fancy items are seen. Why we are always towards the fancy item when our body just needs one fourth of the plate that is prepared and kept in front of us? Have you ever thought about it? It's just our mindset that we have to finish the dish. It is a good thing that you're finishing it. You are not keeping any leftovers. It is a very good thing. You're not making the food waste. But what again? What again? You should always take food only in that context, how much ever your body needs. We have put up a habit like, there are four rotis, we have to eat it completely. There is this much of rice, we have to eat it completely. There are two sabzis, we have to eat it. No doubt we need complete nutrition. But that does not mean you have to, your tummy is only here. You make it over here. Because we don't focus on our stomach, we focus on our heart. Okay? We have to just keep our stomach full, not our heart full. Yeah, it will be. Only when you will have your mindset, yeah, this food is tasty, this is good, it is gonna give me good effects, and yes, it is gonna work for me. 20 to 30% you are filled over there only. Your stomach gets full over there. 20 to 30% when you have that gratitude and that good mindset. Okay, then the food gets absorbed. Mostly this point of doing gratitude, every person should do this, but the patient suffering with IBS, okay, patient suffering with this IBS condition should, you know precisely focus on this point, that you should love your food while you are having it, or before having it, or after having the food. Yeah, I had good food, it is going to give me good results, it is going to get digested well, all of the nutrition which my body needs, it is going to get absorbed properly, and next day all the toxins will come out of the body. What my body doesn't need, it will go out, it will flush out. Again, I am standing straight, I'll be handling everything well. My food helped me a lot. Simple. This has to be your mindset. It will hardly take 2 minutes to just think about this and consume it. Chew it properly, consume it properly. Okay, all of this you have to put your heart into it when you're following any diet and when you're sitting for your meals. Diet is like this. Now, according to Ayurveda, what we have to always remember, medicines are going to create good matter inside your body. Always remember. Why we always keep on saying that you have to follow your medicines well, you should not skip your doses, you have to follow it well, so that it will give you good results. Slowly and gradually we will see that your body is turning into something that you really want. You want to get rid of all of this, so medicines are going to help you out because it will create good matter. But the toxins which are already situated inside your body, that has to go out of your body, right? That has to go out of your body. We have to flush it out. How will it happen? It will happen with the help of diet. So how diet is going to help you? At times diet will give you good motion passing. Okay, that in that context, at times your urination, some people, like some patients or some people might have yellow dark urine. They must have observed, even if they have complaints like, I don't have spicy food. I don't consume oily food. I don't consume processed food, but still I have this motion and urination issues. Why this happen? Why this happens? Because you are not understanding. We think that oil is not there in the food. Like if there is a cutlet and we think that oil is not, it is not oily, it is the air fried, it is good. But what is there inside the cutlet? If the cutlet has a good amount of almonds, pumpkin seeds in it, then of course oil is there. Of course oil is there. That doesn't need any outside oil or extra oil to be cooked, but it has within a lot. How it is reacting on your body, you have to remember it, you have to understand it. How much ever, I'm telling you from the very start, understand first your what exactly your body needs, study your body, and on the basis of that consume food. We are here just to help you out and just to guide you, but you are the one who will follow it, and you are the one who will make it reflect on your body. I am just here to give you things like, no, no, just follow this mixed seed laddu ka recipe. Just follow this recipe, it will give you, mixed seeds will give you good hair growth, it is a rich source of biotin, it is good, B7. Biotin is B7. It will be in a very good context, it will be get digested inside your body. You will get your cholesterol levels will be managed, your heart rate will be good, everything will be fine, your weight will be managed, your skin will glow, everything will happen. Biotin helps in all of this. But in what context you are consuming in it? No, no, it is just a thing, I have to do it in the day. I'll consume the laddu, yeah, today's work is done, now tomorrow. No. Sit, have the laddu in hand. Today I'm having this, it is gonna help me out. Yeah, it is. Talk with your food when you're having it. Show gratitude, show some kind of thing. No, no, it is gonna work well for me. Then consume it. Understanding, you should always show gratitude towards the food, whatever you're consuming. I'm not only telling you about the home cooked food, all kind of foods, whatever you're having it, because it is going to give you energy, it is going to make you stand for the rest of the day to continue with your work, to continue with all of that you have planned for the whole day. So this is how your food works for you. It goes in the minute channels of your body. Okay, the food gets goes in the minute channels of your body. It is converted into energy. It is stored in your adipose tissues. Your body will understand at what time which and where the energy has to be used, everything. Now, one more thing. When I talk about food, of course, we have majority of the patients who are suffering with skin infections. Many patients says ki, I don't have much options to consume. I think that this food is not like this. These are the food stuffs which are not available over here, and I don't think this diet will work for me. It sounds tasteless, or it is not that good, or something like that. We have this kind of things, and of course it is very natural. Of course it is very natural, because we are pulling you over here from this point to this point, where your normal diet is and where this your conditioned diet is. Both are like this, so we have to, I have to work like this to take a midpoint out of it, wherein your taste will also be considered, and the diet which your body needs, which your condition needs, will also be taken care of. Now, in context of skin infection patients, always remember one thing I would like to tell you. You should be, you should never be stressed while you're consuming your food. Just remember this thing. This is the very, very basic criterion that you should always understand and remember, that you should never be stressed while having your food. Tomorrow, now what I have to prepare, it is just a bottle guard vegetable that I have to have, and no, it is not giving me any taste. Prepare something different out of it. Why you are consuming it, again the same, the thought process matters a lot whenever you are consuming the food. Okay, whenever you're consuming the food, there are many doubts regarding the diet, so I'll clarify it one by one. The first thing, always remember, I'm talking about all the conditioned patients. Like, it is a generalized thing which I'm telling you, a generalized thing. Always remember, may it be skin, may it be joint pain, may it be IBS, still have certain different points, but you can still consider it in that. Diabetes patients, thyroid, then there are many other conditions, number of conditions. All the patients diet will be covered in this. Okay, these points which I'm telling you right now, you must have. I hope all the patients and all the consultants have gone through the do's and don'ts chart. We provide over here, the patients who visit over here, and we provide a PDF of it online, when the patients are connected to us online. Okay, so I hope everyone has gone through it. So there is a long list of things which we have given, so it is very, at times it gets very tedious for us to go through the list to understand each and every point. So I'll clarify it in a very short time. First thing, always remember that you are not supposed to have any dairy and dairy products. Now here, what important is, you are not supposed to have any dairy and dairy products. Your exception comes. If you are too much addicted to tea, you can have 1 cup of milk tea a day, in the morning, most preferably. If not, then in the evening, but before 6, before 5. Okay, not after that. Now here, you don't have to divide the 1 cup into half, and half in the morning, half in the evening. Usually people do that. You are not supposed to do this. Again, you can cook food in cow's ghee, again a milk product. Yes, it is good. It is really considered good if you consume food cooked in cow's ghee. It is really appreciable if you're doing it. Okay, third thing, very rarely, and some of the patients can only follow it if I am giving you the authority to do it, otherwise you are not, that you can consume homemade buttermilk. The buttermilk which is prepared at home, you can have it without masala and stuff. You are not supposed to add any masala or anything. It is made out of curd. That does not mean you are supposed to consume curd, yogurt, or ice creams or anything like that. No, buttermilk has less acidic content in it. That is why we allow it. That is also homemade. Curd has a lot of acidic content in it, and we cannot allow mainly the skin infection patients to consume curd. Mostly people have the habit of having flavored yogurts, curd with food, with their meals, and then only it gets digested. I completely understand it is a very, very good probiotic. You can have it, but now again, one thing, I'm repeating the same point. It is good for your body, but not good for your condition. And priority is your condition, not your body. Condition will get better. Body on its own will be better. Always remember this thing. Second important point, one more thing in the dairy and dairy products. If anyone is prone to have coffee and not tea, avoid coffee. Avoid tea. We don't want it. Caffeine is a lot more in coffee powder, and caffeine is compared to that coffee powder, caffeine is less in the tea powder. Understand, this is the difference why we tell you you can have tea and not coffee. Okay. The second, again, someone put up a point over here. What about matcha? No, matcha is also not allowed. At times, we always heard about it. It is good to digest. It is good. It is organic. We can have it. Immune boosting and all of that. But again, currently, your body is not in that state to accept it, to digest it. So it might give you certain other effects as well. Not in the form of your skin infection or any other condition, but it can be something else as well. Okay, now it depends from person to person. Okay, so no, avoid it. For IBS patient, dairy product is a strict no no. A strict no no. You should not consume. Completely avoid it. Okay, completely avoid. Now the next thing, second point, completely avoid the sour and sour items. Now here a very big, very big, very big, thing comes up. Sour items means there are a lot of sour things in nature. What exactly we need to avoid? Start from your lemon, your sour oranges, sour grapes, your sweet lime, kiwis, pineapple, tomatoes, tamarind, all of that has to be completely avoided. But now here again the exception comes. Again the exception comes. Usually people have the tendency, like in everybody's home, in my home as well, when we cook curries, when we cook soups, or we cook dals, we always put tomato in it. It is the basic ingredient. We cannot avoid adding it, okay, because we have a joint family, we have all of that cooking things and stuff, so of course addition of tomato is important. So cooked tomato is always acceptable, raw tomato is not acceptable. So, if you were using one whole tomato in a preparation of one curry, start using half of it. Always remember, when we cannot avoid the whole thing, we should at least take care of the quantity of using it. If we cannot avoid tomato, at least lessen down the quantity. So, you have to take out the loopholes. You have to understand, you have to be that sharp, and you have to understand, you have to make yourself understand, no, if I cannot avoid this, now what can be done? Because I have to cook food, I have to have this thing, then how it can be handled. So this is how the tomatoes can be taken care of. Okay, wherein a bit of it is allowed. If from very start you are using half tomato in curries or vegetables, then use more half of it. Make one fourth of it. Use one fourth. You just need the taste. You just need it to get the dals, the curries to be prepared. Add utna, that is okay. All right. Now the next thing, lemons are completely no no. Sour things, everything has to be completely cut it off. You should not have it. No kokum as well. Okay, when we usually put it in curries, soups, no, you should not have it. Lemons, no, you should stop buying lemons only, because Indian families and lemons are something always connected. We always need a sprinkle of it. So completely avoid it. Now, the third thing when we talk about is, you are not supposed to eat any bakery and bakery items. Okay. No cherries as well. Cherries has to be completely avoided. No plums. When I talk about dairy and dairy items, you are not supposed to have any bakery products. So biscuits, khari, toast, butter, cheese, again cookies, pastries, pasta, Maggie. Now here again 2 to 3 exception comes over here. Now what exactly they are? First thing, always remember, according to Ayurveda, there are certain food combinations that you are not supposed to consume. Okay, two main food combinations which we always tell the patients to take care about. May whatever you condition suffering with, other if you're suffering with, if you're not suffering with, but you are not supposed to have it. Those combinations. First is, you are not supposed to have, anything sweet and sour together. Sweet and sour, or else sweet and salty together. To be very honest, not sour but salty together. For example, we have a habit of having chai chapati, tea roti, tea biscuit, tea khari, tea toast, tea and other maida products, tea pav or anything like that, tea bread. You are not supposed to do that. This combination is very bad. Tea paratha, tea poha, tea upma, not done. That combination will just aggravate your condition a lot. Whatever you're suffering with, even if you're not suffering with anything, still something, some or the other thing will come up. Okay, either you'll face acidity, either you'll have had headaches, either you will have some digestion issues, either some patches on the skin, either some irritation, either some pitta aggravation. Anything can happen, any these are certain things which I told you, but yeah, there are many other things that you can suffer with. So this combination is a complete no no. You are not going to have it. The second food combination is, you are not mixing any dairy and dairy products and any fruit together. No mixtures allowed of dairy and fruit together. Any milkshakes, any smoothies, any ice cream, you are not supposed to have it. Now, here one thing can be done. Some people are very much prone to have this, acidity issues, or some people always say that I have a very, I love having a cold taste, but I cannot avoid having ice cream, smoothies. I really have to have ice or something like that. Something cooling should go inside my body, wherein milkshakes, smoothies, ice creams are my go thing. Patients are there who always say this point. So here what you can do, okay, here one thing you can do, that you can have fruit sorbets. Here I can just manage it out for you, that fruit sorbets is an option that you can have it. So basically what exactly it is, you have to just take out the pulp of the fruit, whatever, whichever fruit you are allowed to have. Now here what fruits you're allowed to have, all of the conditions which cover the fruit, like apple, pear, sweet pomegranate, you know that is again okay. You can have these fruits. So you can have bananas as well. Elaichi banana, the chota one that comes, that is considered as much better than the big one that comes. Okay, so that is it. Watermelons are there, but again it depends. Now we can see that watermelons are coming as injected, reddish in color and all of that. So again we have to be very careful about it. Okay, so this is something, you just have to take the pulp out of the fruit, and you can just keep it in the refrigerator for few times. So now at times people add jaggery in it, at times honey syrup, or at times vanilla syrup for taste and stuff, but you don't have to add anything. Don't add anything, just keep the pulp in a candy form, or in a a small cup form in the refrigerator, just for few minutes, or few like 1 hour or something like that, 30 minutes, just to give it a cool texture, and then consume it like a popsicle, like a candy, like this. So something good is also going inside your body. Your body is getting a good thing, like a detoxification, cleansing your body is getting, and again your taste is also taken care of. So this is something you have to find out the loopholes. This is what I'm telling you from very start. When you cannot, when you have to avoid something, but you have to have it as well. So what can be done over here? We are not doing any mixtures over here, but yes, the natural thing is only converted into some other stuff, and we are having it. Understood. So this is something that we can do. When we come on the, so yeah, so one more thing over here, I forgot to tell you that tea and oats won't work, milk with oats won't work. Okay, you should not have it. And yeah, then what exactly with the oats you can do, you can just add a bit of water in it, soak it for few hours, or else just stir with water, or some at times when patient's condition gets better, I always recommend them to go ahead with oat milk as well. So at times it doesn't mean that you should have it now. You can avoid having it. You just avoid having it. Just take the oats with water or something like that, and then consume it. Okay, you are not supposed to take with coconut milk until and unless I go through the condition. I see, we give it a word that yeah, we give it a permission, yes, you are supposed to have it, and then you consume it. Okay, then only. Otherwise, no, it's a no no. All right. Now, next thing, I hope everyone is clear about that bakery items. You are not supposed to have it. At times, patient asks me, wheat noodles are there. Can I have it or something like that? Once a while, good, have it. Once a while, okay, no problem with it. You can have it, but that does not mean when you are preparing the wheat noodles, it should be, first of all, it should be homemade. What you all must be doing, of course, everyone is good to go with the diet till date, every like whatever I said, everyone is following that, I completely understand. So the wheat noodles has to be prepared at home. No addition of sauces, no addition, nothing like that, just the plain stuff, what masalas or something you have to add, make it as a homemade noodle. Okay, make it as a homemade noodle and consume it. That much leniency I can give you. That much can be really taken care of, so that is okay. All right. Now the next thing we come up to is, you are not supposed to eat anything raw in context, raw in your foodstuffs. Always remember, now this is a very critical and important point, understand it very well. Nothing raw has to go inside your body, nothing, except fruits. Except fruits, nothing has to go raw inside your body. For all of the conditions, for all of the conditions, I'm telling you, you are not supposed to have anything raw. Now everyone is about to think about, then what about the salads? It has to be boiled, steamed, air fried, sauteed, roasted, grilled. Do whatever you want to do, use any cooking method. Use any cooking method. I won't mind. Of course, not deep frying. Okay. Any cooking method is allowed, but nothing raw has to go inside your body. No tomatoes, no onions. Ginger garlic is to of course avoided. You are not supposed to have ginger garlic. I hope everyone knows that. If everyone has gone through the do's and don'ts chart well, ginger and garlic are a strictly no. Are a strictly no, you should not have it. So tomatoes, onions, lettuce leaves, cabbage. I could say mostly the red cabbage. Then what I could say, capsicum, the bell peppers. No, everything has to be stir fried, boiled, broiled, cooked. Anything, any cooking method is okay, but nothing raw. Okay, nothing raw. Minimal amount of tomatoes and onions has to be taken care of. You are not supposed to have it in a very good quantity, as I told you. Even though your onions, okay, onions also has to be, if you were using one earlier, have make it half. If you're using half earlier, make it one fourth, like this. So this is something you have to take care about. Okay. Now, the raw food stuff, I hope everything is clear about it. You are not supposed to do this. Okay. When it comes to cucumbers, okay, of course, cucumbers is something of, if we boil it, it will be like squishy and it will turn up into water and stuff. So of course we cannot do boiling, but of course we can saute it. You should have that thing like thoda sa, we can add a cow's ghee, like a drop or two, and just saute it and you can consume it. Otherwise, if you are not, it is not, you are not able to cook it, or you are not able to stir fry it, avoid it. But don't take anything raw or anything wrong inside your body. Not raw and not wrong. If you know that it is harmful, if I'm taking it raw, it is harmful for me, just because I don't know how to cook it, or I'm not understanding how to take a way out of it, avoid the food stuff. Avoid the food stuff other than having it and creating problem to your own self. Don't do this. Okay. The next thing now, to be very honest, the next thing, you are not supposed to have any stale food. Anything stale is not allowed. Now, here again, one important point comes up, like anything which is prepared today morning, completed by today night itself. Completed by today night itself. You are not supposed to keep it in the refrigerator and consume it next morning. Cook food according to the parameters, according to your hunger only. If you think that only this portion is enough for me, I'll have only this portion. Don't make it this. Just because I feel hungry, I want to have it. No, nothing like that. Okay, if your body needs this much, have this much. If your body needs this much, have this much. Only cook that much kind of food. Just because you have, like, of course it is a good thing that you don't want to throw the food, and of course these are the back thoughts that we always go through, but that does not mean you will just just we are not throwing it, that means we have to eat it. But again, it is going to give you a lot of problem inside your body, acidity issues, gastric issues, all of it, which is again not good. Okay, you need to completely avoid it. All right. Now the next thing,
Yes.
what you have to eat, when I talk about when I talk about the stale food, one more thing, whenever we have the international patients over here, okay, when the international patients talk about it, or here as well in India, what we say, we always have the frozen packets coming over here at our place. So now what exactly people have the thought, now we don't have to eat stale food, but what about the frozen food? Of course, at a point it is also stale, to be very honest, but yeah, it has, the chemicals and the stuff, so it is healthy. So you can have frozen food, not in a good quantity. Again, let me be clear, not regularly, not in a good quantity. At times it is okay, you can have frozen foods, but once the packet is open, cook it, finish it. Don't refrigerate it again in the night and consume it next morning. Understanding the point is same. The point is very same. Okay. What about whey protein? Yeah, when I talk about whey protein, homemade proteins are always good. Homemade proteins are always good. If you need any recipes or anything like that, we can surely provide you the recipes for the protein stuff, the whey protein specifically, but don't go for any kind of dabbas or anything like that. The things that come out over here, until and unless we ask you to go ahead for. It is not like that they are bad or something. Of course they are good, they are nutritional, but again, your condition, your body, always remember those two things. Okay. Yeah, so the stale food part is also clear. I hope everyone has gone through that point as well. Yeah,
Yes,
so this is it.
Doctor. Sorry to interrupt. Thank you so
Yeah.
much. I believe Supraja ma'am has raised the hand, so I
Yeah.
may request her if she can unmute, and if she has any question that she would like to ask Dr. Unnati, she can. Yes,
Yes,
Supraja
yes.
ma'am,
Please, please.
please. Yeah.
Please, please.
Hi, doctor. So when you
Hello.
said, hi, thank you for all the information and
Always well.
so actually you said like no raw ginger, garlic, tomatoes, onions, and capsicum, right? Like
Right.
as we cook ginger garlic, like we use ginger garlic paste and all, right, in pulavs and everything. Is
I
that
know.
fine? Or should we avoid that too?
You should avoid that too as well. You know why? Because they are pungent in taste and they give heavy flavors to your food. Okay, it is good to have it, even though when we suffer with fever and all of that, now we have usually heard that ginger and garlic works the best with, rice dal, and it will cure all of your fever and everything. But again, it is acidic in nature, and it is not easily digested. Okay, so always remember these things. Anything that is giving irritation to your stomach will always give you irritation in whatever you are suffering with. Either it will aggravate your condition if you are suffering with anything. If you're not suffering with anything, you will suffer with something. Some
Okay.
of it. If your digestion and your immune power, your the gastric heat what you have inside your body, if it is not in a good context, it won't digest your food well, and it will give you irritation. So avoid it as of now.
Is that the same with like onions and capsicum as well? Because
It is, but to be very honest, when we have these kind of I could say contrasting things over here, so we always, talk about the percentage. What kind of acidic percentage or growing factor these both things have? If I have to put it about ginger garlic and onion capsicum, ginger garlic is 80 to 90%, wherein onion and capsicums are there, but again, comparatively less. Okay.
oh,
Yeah. So it is 30-40%. So again, adjustable, manageable. You can have it.
okay, so also like I'll be traveling here and there basically, so that's a big problem for me because
I
even
know.
if I take food outside, it'll be just be there for like a day, and rest of the
Yeah.
day to find some alternative, which is very very difficult because
Right.
these
Right.
will have to be something or the other.
I understand. I understand. So in that context,
Requesting just a second. So sorry, doctor. I will mute the
no problem.
person.
No
I'm very
problem.
sorry. You will go ahead.
No
Yeah,
problem.
thank you.
Yeah. So, ma'am, what you can do, when you're traveling, the very first thing, always remember one thing, not only for ma'am, but for everyone. When you're traveling, always remember, do not starve. Just because you are not, you're supposed to have this, but you only have that option over there. Now, always now, listen properly. Listen properly. If you only have that option over there, consume it, but in a less quantity. But if you have options over there, now of course you have understood your diet very well, that paneer is a no for me, this is a no for me, this is okay, that works for me, I can have that. Take it, grab it, consume it. But now if you know that only chicken is present over there, I am not supposed to have chicken. Or let's take a veg dish, paneer. If paneer is over there, which vegetarians, non-vegetarian both can relate to. Now paneer is over there and I'm said no to dairy and dairy products, then what can I do? No option is there and I am starving, I am hungry, I have to have it. Don't go harsh with your body, consume it. Consume it, okay? Consume it in a little quantity. Later we will take care of the detoxification. But don't take this thing or the thing which I told you right now lightly. Just because yeah, I can have it, I don't have to starve, I am hungry, I'll have it. No, your body can adjust with it, it's okay, but don't be harsh on your body. If the thing is there, consume it while traveling. So while traveling, frankies are there, tacos are there, or sandwiches are there. Mostly we get sandwiches over everywhere. Now bakery product is there, have it. Now in that bakery product also, white bread, brown bread, all of that. Now that is your choice. Now everything raw comes in it. Understanding raw is a no, but now there only raw is there and you have to consume it. You cannot avoid it. Have it.
Okay.
Have it, but in a less quantity. Okay.
Even it's the same for like the gluten-free flours like that we use at home and we bake. So we should not eat that as well. Okay.
At home, sometimes once in 15 days, once in 20 days, acceptable. Homemade, acceptable.
Okay.
Work on your sugars, work on your salts. Always remember, not only for you, but everyone present over here. Always work on your sugars, always work on your salt. Sugars will give you inflammation if you have it in a good quantity. Salt will give you irritation, a lot of irritation. So inflammation and irritation are two things that can always aggravate your condition. So sugars and salt has to be taken care of in context of your weight, your IBS, your skin, your pain, everything.
Yeah, last question. So I've been using packed pastas, like the raw pastas, like we do have dried pastas, like made out of chickpea or like just like brown rice and all, only just brown rice. Can that be consumed? Because I'm a big fan of pasta in a way, and I usually make it with coconut milk, just with that, and just like very spices. I don't put any other spice.
Okay.
So that's fine. Because and how frequently can we eat it if so?
Okay. So basically, a first thing, it is not fine. You should avoid it because it has chickpeas and all of that. And again, the next thing is that just a second. I'm
Just hold on for a second, Suprajan. Just a second. Maybe there is a patient here.
I'm so sorry. I'm so sorry. There was an emergency. Okay. So yeah, the pasta which you were telling me, not acceptable. First of all, it is not allowed. It has chickpeas and all of that, and when you cook it, you are using plant-based milk, and all of it, spices are there. Again, some of the other kind of irritation will happen, but again, once in a blue moon, if you're consuming it, only 25 grams or 30 grams of it can be acceptable. You can have it. Okay, that is again good. So this is how it is. Otherwise, completely avoid it.
Okay.
Perfect.
Yeah.
How
Okay.
long?
Hello, ma'am.
Okay, so we'll take one more last question. As this meeting is going to about complete by 9 o'clock, I believe. So, a
Okay.
last question from Mr. Prince, I believe. He can
Yeah.
please
Hello.
unmute yourself. Yeah,
Yeah.
Doctor will take the
So,
Hello.
last question
hello.
immediately.
So, ma'am, you
Thank you.
mentioned bell pepper and onions are not good. This is for the psoriasis. Is it? Am I right? Same goes
Yeah.
for the rava upma. Same goes for the rava upma.
Not exactly. Rava upma is still acceptable. You can have it. You can have it. I'm not saying no. But how the way you're preparing it, that matters a lot. If you're adding green chilies, if you're adding lemon in it, then it is not acceptable. Green chilies will increase the pitta vat inside your body, which is again not good. So avoid it. But rava upma is okay. You can have it. The gluten content in it is not as great as it is in wheat, but fine. So that is again, but not with the combination of tea. Remember this.
Okay, ma'am. You also mentioned recommend to use the ghee, but is it also okay to use the coconut oil while preparing the food?
Yes, yes, you can. You can have olive oil, you can have coconut oil, no mustard oil, no sesame oil. Mustard oil and sesame oil are a big no-no. Otherwise, everything is okay. But always give first preference to, cow's ghee. If not, then have other oils. That is okay.
Okay, sure, ma'am. So, ma'am, my last question is like, do vitamins D, B12, or vitamin C, omega-3, or the calcium play the specific role in managing the psoriasis? And if so,
100%.
what food or supplement would help improve this level? Because my blood report, shows
Correct.
the values are at a lower side. Because since I started the diet which is provided by you,
Correct.
there are many things which. So if you can help with that.
Yeah, so I completely understand this is gonna happen. This is a part of the treatment. So this is gonna happen. I'm not saying no. Of course, I have given you a very, a very low options for having the vitamin D, vitamin B12, and vitamin C consumption. But again, with that, what vegetables we have asked you to consume, you should have it in a good quantity. Okay, focus on your proteins more, focus on your carbs less. That is how the sugar and salt works together, which I told you, so which I had a discussion about it 5 to 10 minutes back. Okay, this is how it goes. So when I talk about vitamin D, vitamin C, vitamin B12, there are certain cereals which are fortified with it. Okay, if you need a list of it, then of course just have a word with your health consultant. Specific sir, specific ma'am will get back to me. I will prepare I have a list of it. What fortified cereals you can consume to have a better absorption of all of this. Okay, so we have options. I'm not saying we don't have any options. Like you, there are options wherein your multivitamins and your these things can be taken care of. So don't worry about it.
Thank you so much, Doctor. I believe we have just last 8 minutes. So what I will do, Doctor, I will quickly one by one ask you the questions. Those are put into the chat box. You can answer one by one. Okay. I will open the chat box. The question from Mr. Rajesh is that for a skin condition, can the patient take sunflower oil, Italy, and dosa? The
Sunflower
question.
oil is okay. Idli dosa are okay, but again, non-fermented. If they are fermented in the sense addition of that is fruit salt, or addition of curd, addition of buttermilk, addition of lemon is not allowed. If naturally you are fermenting it for 2 to 3 hours, then it is completely acceptable. You can have.
Super. Thank you very much, Doctor. The another question from Mr. Henry is that what should you take to build up a good immune system? Like what kind of food a patient can have to build up a good immune system? Like, some of the good remedy that you can
Correct.
suggest, which is easily available for the patients.
Yeah.
Yeah.
So it is a first thing that it is not a single food that will help you in building your immunity. It is a combination of foods that is going to help you out. The thing is not present outside. I can give you outside options, but it would be a mixture for your body, which your body will reflect in a very bad way. You can have it a homemade thing. If you need, I will give you certain recipes, certain stuff wherein you can prepare some laddus, or you can prepare certain powders. You can keep it and you can have the scoop of like one scoop, two scoop mixed with water. Consume it in the morning. Your immune system will work well. Or some salad options like this. So this is how it will work out.
Thank you so much, Doctor. The another question, I believe it's from Mr. Sudarshan. He is asking for the skin condition. Can the patient take the turmeric? Like it should be in a limitation or What do you suggest about the turmeric powder?
Turmeric is again good. You can consume it as antiseptic. So it is going to heal you from inside. So it is again good. You can have it. But anything which goes out of the limit, beyond the limit, it gives you very bad effects. So don't consume it in a very good amount. Somewhat is okay. Somewhat is okay.
Okay. All right. Thank you, doctor. The another question from Mr. Anil says, any specific reason for the mustard oil and the sesame oil is avoided for the cooking purpose? Like,
Okay, so basically, oil works as an emulsifier, always remember. And the way we cook, we Indians have a habit, okay, so to cook everything so well that either the nutrition goes away or either the food will give you certain other kind of taste only. Always remember this. We Indians have this habit of cooking. अच्छा बना है, वो cook हुआ है, all of this, okay? Is the soybean cooked properly? We will poke the soybean like this. We will check it if it is cooked properly or not. So this is how it is. So when we are cooking something in oil, we always need to understand how good the oil will be emulsified. Okay, so mustard oil and sesame oil will be emulsified very highly and could be toxic in nature, and it will increase the acidity and it will give you heartburn, chest burn over there. So not recommended. Avoid it.
all right. Thank you. Noted, doctor. The another question from Mr. Sudarshan again says, that is turmeric with milk advised for a skin condition patient?
Not advised.
Not
Completely.
advised. All right, all right, all right. Okay, the another question from Miss Kajol says, can we cook the food with sunflower oil and groundnut oil? Which one is the best that you recommend?
Sunflower, but my preference will always be cow's ghee. If not cow's ghee, then olive, then sunflower, but no groundnut. Avoid.
Super. Okay. The question next says, doctor, about from Miss Monica. What about the plant-based, milk? Do you recommend to the patients?
Yes, we do recommend plant-based milk, but again, depending on how good you are going ahead with your condition, how good your body is responding with the condition, and on the basis of that, we will ask you to have it or not. Again, in that, almond milk is a complete no. It can give rise to itching, so avoid it. Otherwise, sometimes we allow it for oat milk, coconut milk, that is fine. Not soy milk as well.
Perfect. Thank you very much.
Just
The another question, we have last 4 minutes. I will quickly go ahead. The another question from Mr. Mayur says, is bitter gourd, which is the Karela, is it good for the skin conditions? Like, does it help for killing the fungus or the fungal infection? What is
okay.
your advice on it?
Yes, yes, it does help. It does help. It will give you good results, but it does not mean that it is going to help. So only every day you'll have that bitter gourd, bitter gourd. No, no, no. It is not like that. You can cook different dishes with it. You can cook different dishes. Sometimes you can make chips out of it, air fried chips. Sometimes you can make vegetable out of it. Sometimes juice. Yeah, it is good. You can have it. No problem in that.
Okay, okay. All right. Thank you very much, doctor. The last one or two more question. The
Yeah.
next question is from Miss Pooja Mitra. It says that I have been taking Avla and it works wonder for especially for my bowel movements, and she is belonging from London, I believe. Okay. So generally what we advise at, as it is the SAR in the nature, and if any person who is suffering from the skin condition, so would you recommend still, as it is rich in vitamin C, would you recommend the patient to go ahead with Avla, or it is advised to stop? Please go
Yeah.
ahead.
So basically, Avla, first of all, is really very good. Nothing against about the Avla thing. But yeah, just because it is giving you results for a single thing does not mean your body is okay with it. Some or the other way, it will be thrown out in some other context. So just avoid having Avla. Like, of course, you won't be having it on regular basis or out of the box. You would be going out for it, but just don't be over with the Avla. If you need some other options will be given to you, have that. That will give you better results in all of the things you are suffering with. Okay, like digestion,
Sorry,
your hair, your skin, everything.
I just want to mention it here. Sorry,
No
this
problem.
is Pooja. So the avla I used to take in India, it was really sour, but in London it's not, actually not. So when I consume it, it's actually, I don't feel it. It's amla, but actually it's amla, and I
Yeah.
I take it so sometime.
Correct. So avlas are basically not sour in nature. Anywhere you won't find it sour. In India also, it is not sour. The taste, at the very first when I started with the lecture, I said that there is a taste known as pungent. Pungent that will give you a
Yes,
very
kind of.
sharp,
Yes.
yeah, a very sharp taste, but at times unpleasant. You might feel bitter, you might feel unpleasant, a mixture of
Right.
taste is there. So avlas are like that. The Indian gooseberries, usually we know it as, but
Yes.
still, I would say no. Even if it is not sour in nature, but it is pungent in nature, and according to your condition, currently it won't go that well. I'm not asking you to stop it directly, like it's a no from tomorrow.
Yeah,
Lessen
I
down the
understand. Yeah.
quantity. Lessen down the quantity. Slowly and gradually,
Thank you
we'll
so much.
provide some other
Perfect.
options. Done, done.
Perfect.
Thank you so
All
much.
right. Last three questions, doctor. I may just recommend you to tell yes or no because it's been almost 9 o'clock. The last three important question from
Yeah.
Jayanti. The question from Jayanti ma'am, it says, is it good to have the pasta when the patient is diabetic? Yes or no,
No.
doctor?
No.
No, no. Okay, Jayanti ma'am, the answer is no. Mr. Rajesh sir, the question says that almonds or the cashew nuts, can a oral lichen planus have 4 to 5 almonds, per day?
No.
Or
Both of the
okay,
things are not allowed.
both of
Oral
the things
lichen
are not done.
plants. Yeah.
Okay, understood, understood. All right, all right, all right. The last question that I may take from this, from Akruti Munshi, ma'am, there is a question which says frozen uncooked drumstick. Is it fine to take or not? The
It is
frozen.
fine to take, but drumstick should be always taken in a rare, okay, in a rare thing. It's a rare thing to take. Like once in 15 days, once in 10 days is fine, or once a week, drumstick is okay. I'll recommend like once in 10 days, drumstick is okay to take, not
All
regularly.
right. Okay, fine enough. Thank you so much, Dr. Unnati ma'am. I really appreciate your time. The 1 hour of session, I believe it is really helpful for each one of the patient. I can see the heart reflection which is coming across. So thank you very much to the entire Jyovis family as well. The every sir and ma'am who is present here over the meeting. We would be
Thank
taking these meetings in future as well. There would be a weekly or mainly once in a month meeting for you to interact. Because we think you are all a family member. Especially Dr. Raj sir had taken this initiative so that we all get connected together and the queries can be resolved. We all can get a very good speedy recovery. So I really appreciate once again Dr. Unnati ma'am. Okay,
you. Most
Hetal
welcome.
Vertukle ma'am, very good.
Thank you.
Thank you
Thank you.
so
Thank
much.
you so
Thank you
much.
everyone. We'll
Thank
meet
you, everyone.
soon in the next session. Take care. Bye bye.
Bye
Take care.
bye. Thank
Okay.
you. Thank you.